So you'll see a little pop-up come up just to approve that you understand that this is being recorded. Each session is going to be recorded individually and be shared with you after this summit. Toutes questions peuvent être posées en français si vous avez des questions à poser, si vous préférez parler en français. And without any further ado, we will now begin our 2 p.m. Eastern Time session, which is the Canadian Research Results presentation. The moderator, Mary Rose Roger. I don't think I see you on this screen.
Mary Rose is here. We're just giving her panelist access.
Perfect. Thank you. And also, if you're just joining us, we have a graphic recorder, Emma Richard. She is recording and designing our conversations, and the design will be shared at the end of this session. We're hoping to have 10 to 15 minutes. I know it's hard because we have such great stuff to share and great resources and amazing conversations, but we are trying to have about a 10-minute break in between sessions. So during that 10 minutes, Emma will be sharing her screen. So without further ado, I'm going to pass it over to Mary Rose. Thank you so much for leading our panel, and I will let you take it over from here.
Thank you so much. If I could just have confirmation that you can hear me?
Yes, very well. Thank you.
Okay, wonderful. Thank you so much. I was having a few technical difficulties. Thank you so much to CCFWE for inviting me to participate in today's session. I'm very, very privileged to have the opportunity to introduce to you the distinguished members of our panel to discuss the really encompassing research on the landscape with respect to economic abuse. And so I'm very grateful for the opportunity to have to be able to share this research with you. We are going to be joined today by Neha Shahzad, Research Director with CCFWE, Dr. Natalie Snow, again with CCFWE, Permilia Shelapemal, who is joining us from the Women's Abuse Council of Toronto, and as well Miranda Philipchuk from the Alberta Council of Women's Shelters. I'm going to ask our panelists if they could please begin their sessions, just introducing themselves and by way of an introductory biography, if you will, before jumping into a discussion and sharing their research findings. And with that, I would like to begin with Neha. Over to you.
Thanks so much, Mary Rose, and thank you for being the moderator for this session. I know you have a lot going on. Mary Rose is the director at Canada Revenue Agency, so we'd like to thank her for taking time out of her very busy schedule to be here. As I mentioned, I am Neha Shahzad Chandarajan. I am the research director here at CCFWE. I've been with the center since 2020. Yeah, it's been 2 years. And also full-time, I'm also a policy analyst for Natural Resources Canada. Are we going to go around to all the panelists, or do you want me to I can just start?
If you could please just start. That'd be
I'll
great.
go ahead. Thank you, Mary Rose. All right, I'm just going to quickly share my screen. Is it this one? Let's see. Make sure that, okay. Sorry, my dog is also chewing her bone in the background, so please excuse her. I'm having a couple of technical difficulties, so I'm going to have to go back and go out and then come back in. Just one moment. Sorry about this.
Maybe I'll just introduce myself then while Nia does that. So my name is, well, we met earlier, is Dr. Natalie Snow. I am the research analyst with CCFWE. My research focus is on the broader gender-based violence and sexual violence and human trafficking. Like outside of here and through my academic studies, I also focus on Indigenous women and violence, victimization and criminalization. So what am I there? Oh, I'm a part-time instructor with Wilfrid Laurier University, Humber College, and University of Guelph Humber as well.
And while we just await Neha's return to the Zoom call, Pramila, if I could ask you to, as well to introduce yourself.
Yes, absolutely. Hi, everyone. My name is Pramila. I'm a project coordinator here with Women Abuse Council of Toronto, or Women Act. A bit about myself. I've been in frontline work for, I think, around 15 years now with different shelters in different jurisdictions, and now moved into research. So I'm doing a few research projects on economic abuse and employment sabotage with Women Act.
Thank you so much. And as well, I'd like to introduce Dr. Miranda Philipchuk, please.
Thank you, Mary Rose. Hi, everyone. Thank you so much for joining us. And I'm Neha, I see you're back. I actually really look forward to seeing if we can meet your dog chewing their bone. That's very adorable. It's not a proper Zoom call without someone's pet crashing the call, right? So.
Oh yeah, for sure.
I'm Miranda Philipchuk. I am the Research and Evaluation Coordinator at the Alberta Council of Women's Shelters, which basically means I lead the small but mighty research and data team, and I'm responsible for establishing the research agenda. And before coming to community-based research, in my previous life, I was an academic. I researched and taught at Villanova University and specialized in gender-based violence, pretty broadly construed. With specializations in intersectional feminist theory, legal theory, decolonial theory, and critical race theory. So all of the good areas are interests of mine, and I'm very happy to be here with you all today.
Thank you so much. And Nia, can we go back over to you?
Yes, we can. Everything is all set. So please just let me know if you can. I think just a moment. Can you see this?
We can.
Okay, and I'm going to put it into presentation mode. So I'm going to be discussing our study on access to economic resources during COVID-19 in the National Capital Region. So CCFWE conducted this study last year to understand how COVID had affected economic abuse victims and survivors. This study was also funded by the City of Ottawa. I just want to take a moment and say that I am speaking to you all from the unceded and unsurrendered territory of the Algonquin and Anishinaabe Nation. So thank you very much for all of the Indigenous people for their valuable past and present contributions to this land. A quick thank you to all the survivors and victims who had participated, to Messeret, who is our executive director and founder, and we had a number of organizations who participated in drafting the survey, so we'd like to give them a big thank you as well, and to the City of Ottawa for funding. So some of the key findings that we found from the study were that over 80% of women who participated said that their instances of economic abuse increased during lockdown. All of their financial options and welfare benefits, employment, education, housing were limited by the actions of their perpetrator. And due to these financial constraints put upon them by their abuser, women were unable to leave their abuser or had to go back to their abuser if they had already left. Among a ranking of a number of different service providers, financial institutions were ranked as the least helpful amongst all of the different services. So just a little bit about the research design. So we had a phase 1 and a phase 2. Phase 1 was a quantitative survey that was sent out online to victims of economic abuse. And phase 2 was a focus group, a qualitative focus group that we conducted with three of the survey participants that we had. And we asked them 5 open-ended questions about their experiences of economic abuse. So on to the results. I'm not going to spend too much time in the age and the demographics, but as you can see, the largest population that we had, 85%, were between the ages of 26 to 35. Most of them also had a high school degree, and 26% of them had a post-secondary degree. In terms of race, we did find it was difficult during this time to access or at least gain access to racialized women. We found the capacity constraints that they had can often restrict them from participating in surveys like this. So 80% of our demographic was white. I'll only go over quickly over this. So the largest percent of our population had an annual income of about $30,000 to $40,000. Most of the participants were married, 70% were married, and also most of them, over 60%, were still living with their current partner and were married. So the impacts of employment, what we used in our survey was something called the Scale of Economic Abuse. It's an academically verified scale that's adapted from Adams, 2008. And it has a series of questions to identify what forms of economic abuse the victims are facing. So in terms of employment sabotage, I won't go through all the stats here, but you could see that 60 to 86% of women had experienced employment sabotage at some point in their relationship. And this includes things like their abuser threatening to make them leave work, demanding to quit their jobs, facing physical abuse if they go to work, and even so far as, please excuse me, having their means of transport taken away, like someone taking away their car keys or taking away their bus or transit pass. In terms of economic exploitation, and what that means essentially is when the abuser is taking away the woman's and the victim's financial resources and exploiting them for their own gain. So as you could see, over 85%, so 85 to about 95% of the women had experienced economic exploitation in some form. And again, this includes having their money outright stolen, having their perpetrator take away their paychecks or their financial aid checks or their tax refunds, being physically hurt for even paying the bills for things that they need to pay, like their utility bills, going back to ask for money from their friends or family, and then having the abuser tell them, you know what, you're not allowed to pay them back. Again, convinced by the perpetrator to lend them money, but also not being paid back for that. Building up debt in their name, which is one of the most common forms that we see and is often the most destructive. Or having their rent or bill money spent by the abuser without their permission. In terms of economic control, 84 to 93% of victims and survivors experience economic control. So this includes when victims' partners demand to know how their money is spent, taking receipts or change from victims after they've gone grocery shopping to make sure, you know, that the spouse is not spending a little bit over their money or their allowance, withholding money that the victims need for food or clothes or childcare or other necessities, having their money hidden away by their abuser, or having their money outright gambled with. Our participants, 64 and 59% of participants thought that they had their items stolen or money stolen before and during the pandemic. Over 80%, so 84%, agreed or strongly agreed that because of their current or former partner's actions, their employment or education situation worsened since the start of the pandemic. Over half were working fewer hours during COVID-19, and the majority of them also said that they were worried about their access to employment and education because of their partner's actions. I think I already said that. Housing was another factor that was impacted by COVID-19. So as 70% of the participants indicated they were living with their perpetrator, the biggest thing to highlight is that the majority of participants said that they were worried, all throughout the pandemic, before, during, and after the pandemic, that they were worried about their housing situation due to their partner's actions. 94% of these women also had their rent or bill money spent without their permission by the perpetrator. I kind of hinted at this earlier, but the majority of participants said that that because their partner had attempted to control their money, this impacted the frequent or the ability for women to be able to leave their partner. So 40% indicated that they had plans in place to leave their partner before the pandemic. 10% of those victims actually had to go back to their abuser after they had already left. As I said, education and employment were really heavily impacted by the abusers. 30% of people who had received any welfare checks, CERB or ODSP during COVID didn't know where that support money was going because of their abuser. And 64 and 59% of the people, again, I've already said this, but thought that their partner had stolen these items from them. All throughout the pandemic, and when thinking about after the pandemic, women were concerned about their employment and education because of their perpetrators' actions. When it came to accessing services, 38% of the participants, so this was the majority, said that their ability to access support slightly improved. 47% of participants didn't experience difficulty accessing help, but a whopping third of the population, found their ability to access services worsening. We found that a fifth of the women did not seek help, and a reason for this might be that 64% of the women said they felt unsafe calling services because their partner was at home. As we know, if your partner is at home, it's very difficult to carve out time to find a safe location to be able to call any services or access any help. So as you can see here, there are ratings of how helpful organizations were for providing support. Financial institutions were ranked as the least helpful, but some of the most helpful were hospitals and clinic, mental health support, and daycares. Women's shelters were also ranked in the helpful range, but it was also noted that they were also unhelpful. There were quite a few women who said that they couldn't find the support they needed from women's shelters, but we know that this is because women's shelters were significantly understaffed during the pandemic and underfunded. Some program areas that were found lacking were programs for older women who suffered from abuse, and the needs of young mothers versus women over 60 are very different. Civil court services and justice legal systems were also lacking, as victims of abuse didn't find that they had a dedicated program to be referred to. And victims just asked for more. They just wanted more people working in healthcare and community centers and social workers and counselors. Most of the victims also noted from the focus group session that abusers try to create these cycles of poverty that victims are locked into. So they can't contact anybody, they can't go to anybody for help, they can't go to their friends and family, so they're simply stuck in the situation that they are with the abuser. Like I said before, financial institutions ranked last for helpfulness. 33% of women selected them as being helpful or unhelpful. There were a couple of limitations to our research study. So like I said, I already pointed out this earlier, we had a lack of diverse representation in this sample, as 80% were white women. Some of the women had come through our newsletter. Well, most of the women had come through our newsletter, so they were already equipped with the knowledge of what economic abuse was. And some recommendations to policymakers that we had after this study. We found that there was a real need to create economic abuse education material and screening tools to support frontline workers. We need to allocate public funds to improve access and quality of family law services, allocate public funds to improve access to affordable childcare, and provide funding and programs for vulnerable women, especially those who are marginalized, such as those in the BIPOC community, immigrants, and older women. Housing supply was also noted in our study. So the need to create affording housing supply is desperately needed. Providing financial institution staff with training and introduce policies on domestic violence and economic abuse, and provide free and accessible credit repair and debt remediation services. Lastly, we advocate for making available information on family law procedures and legal services for all service providers. And I will end it there.
Thank you so much, Nika, for sharing those results with us. And in the interest of time, I'm going to move along to our next speaker, Dr. Natalie Snow from CCFWE, who's going to be presenting the research she led in respect of the national study on service provider insights on the nature of economic abuse. And so, Natalie, I will turn it over to you, please.
Great, thank you, Mary Rose. Just from the beginning. Okay, there we go. All right, so welcome. So I'm going to be talking a bit about our national study, which literally we just wrapped up last week. It's Understanding the Nature of Economic Abuse, a national study on service provider insights. So this project stemmed from earlier research that was done with CCFWE along with their task force, that there was systemic barriers were identified as within Canada's legal system, financial system, and social services system, which have an impact on women's experience with economic abuse. So this motivated us to conduct a study looking at the different service providers identified that would support women who have experienced economic abuse. So we did a I'll just jump here. We did a three-pronged approach, or sorry, back up a little, I'm talking a little fast. We did a we looked at 3 lines of inquiry. We did an online survey for 3 different groups, populations, social service providers, the financial sector, and victim survivors. Based on our results, we see that social service providers had the greatest number of respondents. So through my research, through this presentation, I'm just going to highlight some of what we found with the social service providers, and I've offered a brief highlight for the financial and victim survivors. I also, so for our research questions for this is we really wanted to focus on prevalence. There is a lack of data collected and measure and how it's defined within Stats Canada and other within Stats Canada on the prevalence of economic abuse. So that was kind of one of our focuses, service providers, knowledges, challenges, perceptions, and resources, and also other systems and how these systems impact help-seeking behavior, and then community response, which are there any community models of best practices that support domestic and economic abuse? So as you can see, our financial sector, we were only able to garner 76 as a sample. An online survey for survivors, we only had 80 participants. And then we also conducted interviews with social service providers, and that we had a total of 19 for that, which was a very good turnout for qualitative research. But I'm gonna focus today on the the survey findings. So as you can see in this map from across Canada, most of our participants did come from Ontario, although we did have a very high percentage of representation from PEI, which is the 6.5 down here, and from British Columbia. Unfortunately, we did not get much reception from the other regions, and the lower percentages represent either challenges with getting a hold of people or access to or the ability to take the survey. We also did do the survey in French to send to our Quebec partners and New Brunswick partners, and unfortunately we just did not get much of a response. The geographic location of our participants. So the majority of them were located in a suburban setting. Although we did have, it is relatively even, I mean, within about 10% that we did have representation from the metropolitan, so more of a urban setting, and then also a rural setting. So as we know from previous literature, as we know through previous literature, that there are different challenges, or the way the challenges are operationalized and experienced are different, whether it be an urban or rural or suburban setting. So that's important. We had a pretty good representation through the project. The type of organization. So what I've done is I've highlighted who we've heard from or the highest percentage represented. Majority of our respondents came from women's organizations, but as you can see, we did have a fairly broad range of representation through the survey of through the recruitment process. So the recruitment was done through emails, myself and two of our team members, and we would email organizations and also use snowball sampling is to reach out and ask people to share it among their community, their networks. So what we found is that 93% of the social service respondents had heard of economic abuse, while 63% had not received any training on how to on economic abuse or on how to better support clients who are experiencing economic abuse. And then 52.5% of the agencies responded that they did not have any specific type of support for economic abuse, although they might have other types of abuse, so they have more of a holistic all-around program. So as you can see through this graph here, or this figure, these are the different types of supports offered for economic abuse within the agencies across Canada. I've broken them down into 6 categories: advocacy, education, legal and court support, practical support, counseling, housing, and social programs. Many of the agencies, as we discussed in the social service session, there is challenges with funding, program eligibility based on your funding, and also the knowledge of how we can effectively and efficiently better support clients. So this table here, I've highlighted again just the pre and post COVID-19 and the types of economic abuse that the social service providers are seeing within their clients. Economic control is one of the highest, and we see that most often. There was no change between pre and post COVID, although we do see a little bit of a drop, but I've highlighted the reds for pre and post, and there isn't much of a percentage difference. They weren't, but as you can tell by just looking at the overall table, is that their clients are experiencing economic abuse often, and all different forms of it. So when we talk about what is needed by the clients, we asked the social service providers what was the most requested information as it relates to economic abuse, and the primary questions had to deal with the denial of daily necessities. So this had to do with food, paying rent, or childcare products. We had over almost 50% of the respondents say that their clients ask about this. And then a close second behind was about CERB. And unfortunately, in some of our interviews, we did hear about how CERB was taken out in the partner's name, and now they're stuck repaying it. There was quite a bit of, I think, although a well-intentioned program, there's a lot of implications that have come from that program that is now being felt with many people who aren't necessarily in the position to repay the money, or they're being denied other services because of this owed money. So. Then when we talk about the social service clients, what their clients are expressing as major concerns, I don't think it's any surprise for anybody in this country that it's housing. Nia did touch upon it. We also touched upon it in the social service providers session, that housing is overwhelmingly the priority, and to safe and accessible housing. We will be doing, sorry, I'll just leave it at that. So the client identified behaviors. So we're just touching on some of the ways that partners or abusers are are perpetrating the economic abuse. And again, most of these are actually quite high when we think about the different types of economic abuse. But the number one was demand to know how the money was spent, and spending money that was designated for bills was a close second. We see that economic abuse is not is complex, and that it isn't just operationalized or manifested in one way. Most of these have been presented through multiple fashions. All right, so to try and flip this a little bit, that we don't need to focus so much on some of the negative, I wanted to talk about the findings of what the interventions and how we can better support clients and what's needed to support these clients. So first is the number one answer that is needed as an intervention to support survivors of economic abuse is access to safe and affordable housing, which was brought up earlier as well. That's the number one client concern, but that's also the number one way that we think the participants believe that they can better support their clients and support the healing journey. There were 27% noted empowerment through financial knowledge requires a focus, and then 12% reported that the need for affordable or free employment training would be beneficial to support economic abuse survivors. So here is a bit more of a detailed chart on what is needed on the social services end to better support their clients. So what we can see through here is that it's a lot of this has to do with education and with building capacity within agencies. The education material is one of the number one priorities that we heard from the clients, from the social service providers, and in turn us at CCFWE is going to be focusing on developing these materials and working in partnership with, in collaboration with many agencies to get the training and then how to better support. Because from what we heard with our client within this survey, this research study, is that the identification might be there, but how can we better support? So there's multiple layers to that, right? Within, whether it be provincial services, federal, and then when we talk more about municipal, we talk legal. So there's all of these banners that come together that, and there isn't the knowledge, or there isn't the know of the programs that can better support the clients. So just a quick highlights from the financial services sector. We saw 54% hadn't received training, and then on economic abuse, and almost just as many haven't received training on intimate partner violence. Most of them would not be able to recognize or identify a victim of economic abuse within their workplace. And we also have the people do not know that their organization has policies or processes for intimate partner violence abuse. So most from most from our victim survivors survey, all of our respondents were female. Most of our respondents, 60%, reported as Black Canadians, and most of them also reported being mothers with children currently under the age of 18. So we, from our survivors, we have 88% of them are currently experiencing economic abuse, and 64% are still within the relationship, which means close to 24% of people are post-separation, and they're still feeling the abuse, and they're still experiencing the coercive control and economic abuse. Here we have the most frequent type of abuse was that their partner interferes and controls their money, which, I mean, these stats alone even are astonishing and sad in the fact that it is such a frequent occurrence, and that so many people are still are unable to move from that situation due to various financial reasons as well. So one of our big challenges is that we had the lack of response from the financial sector, which was very troubling because that was part of our goal, but it was really hard to engage with that sector. And then also known challenges reaching out with victims and survivors. We did send the information about the survey and the gift card to many different shelters. Unfortunately, we didn't get too much of a response, but there can be obviously challenges with cell phone access and access to the internet and computer, and then language as well. So for our next project, we'll be looking at ways that we can improve and engage with this sector in a much more conducive fashion. And lastly, so some of our recommendations. Now, I've just done a very high-level glance over of our report. There's a lot more information there, and I believe the link to the report has been posted in the chat. But part of I did mention this in our earlier session, is that we are working right now on validating and creating a tool for economic abuse education and screening for not just for social service providers, but the legal field, and then later the financial sector. We also want to talk about the development of measures and data collection and research that is needed to understand the depths and the nuances of economic abuse, especially here in Canada. There is a lot of work being done in the US, Australia and the UK and the US, but we need to catch up and really define it and measure it so that we have an idea so that we can address it effectively. And that there's also an increased need for funding for shelters and social services. We did speak a bit about that also in our earlier session about funding for employment, funding for salary and wages, which is important, but also the support and services is another important element of it. That was a very brief overview, but I encourage you to go check out the website for our full report.
Natalie, thank you so much for sharing that with us. And so there's a lot for us to dig into there, and I'll invite those on the line as well to post their questions in the chat, and there'll be an opportunity for Q&A at the end of the session. But with that, I would like to turn over to Pramila Shalaparmal from the Women's Abuse Council of Toronto, who is going to be sharing some perspectives with us from recent research on economic abuse amongst senior immigrant women. So Pramila, over to you.
Thank you. Just bear with me a second while I start sharing my screen. Great, I hope everybody can see that.
Excellent, yes.
Okay, great. So thank you for having me here today. I found it really interesting, and I think some of my findings from the research will be reflected in the research that's already been spoken about. So I'm going to be speaking about a project that Women Act did on senior immigrant women at risk of economic abuse. Quickly about Women Act, for those of you who don't know, we are a policy and planning body that works to end violence against women and advance gender equity through research, policy, education, and system coordination. And we are based in Toronto. So the findings I'm going to be presenting on today are based on a report we completed last year as part of our project on looking at senior immigrant women at risk of economic abuse. And this project actually came about from a previous research we did on financial abuse, where we found that senior immigrant women seem to have very particular experiences of economic abuse and face high barriers and unique barriers to help seeking. So we're looking to answer the following research questions. What are senior immigrant women's experiences of economic abuse? How do gender, age, and immigration impact those experiences and the risk of those? And how does gender, age, and immigration impact access to services and supports? The report that we did as part of this project includes a literature review and research findings from a small-scale study that was completed between September 2021 and January 2022. We used semi-structured interviews with 3 senior immigrant women with lived experience of economic abuse, and we also held surveys with community organizations and service providers. The research findings were limited by the small sample size because we experienced a number of barriers when we wanted to do research with senior immigrant women. Firstly, in terms of recruitment, this included hesitancy from agencies and senior immigrant women to engage because of the sensitive nature of the topic and the level of vulnerabilities associated with this population in terms of risk and in terms of being able to access support. We also faced challenges with virtual communication. So the timing of the interviews coincided with health and safety measures during the pandemic. So engagement with survivors had to be entirely virtual, which was a problem specifically for this group of people because to a lack of access to or comfort with phones or other technologies. We also found quite a few safety considerations that came into play as barriers when we were doing research. Many participants we attempted to engage with or did engage with were in crisis or at high risk. This might be because there is increased isolation among this population and high barriers to leaving abusive situations. Also, because of age, the emotional implications of reflecting back on the impact of abuse was sometimes too difficult for the participants because of where they were at life. So kind of reflecting on this process, our recommendations would be to keep finding creative ways to engage with senior immigrant women. They are very underrepresented in research on gender-based violence in general, but also economic abuse. And I think that actually reflects those high barriers that they face in accessing services. I think it's the same in terms of them engaging in community-based research as well. So we do need to find creative ways of having their voices heard. We recommend that you do focused outreach, so target places of worship, centers and groups where they frequent, but also invest time in relationship building with senior serving community organizations to build trust and also capacity building about the value of having senior immigrant voices in research, that there's a balance between the sensitive nature of the topic, but also having their voices heard. We also found that senior immigrant women would benefit from multiple methods of research engagement, including multiple virtual or in-person engagement methods and different honorarium options. So they might need a lot of flexibility to be able to engage in research. So I'll give you a bit of an outlook or a highlight of the main points of what we found. Something that was mirrored in the literature review and also came up in our research is that economic abuse was perceived and identified differently across communities. And the definitions were closely connected with gender norms related to household roles and financial decision-making. And this was different across different cultural contexts. These gender norms could normalize abusive behavior and make it difficult to understand and identify economic abuse. Some examples of how economic abuse was spoken by survivors including having a lack of or a disrespect of economic rights or a lack of decision-making or financial decision-making. Both our study and the literature review found that because of the intersection of age, immigration, and gender, senior immigrant women faced economic abuse from multiple perpetrators. So this includes spouses, children, extended family, and the perpetrators often were the ones that were sponsoring the immigration process. Our study found that senior immigrant women faced multiple forms of economic abuse. It included financial control, stealing, use of survivors' details to open bank accounts or access Social Security in their name, and exploitation for domestic labor, such as taking care of grandchildren. The different forms of economic abuse happened in the context of isolation, which is how kind of age plays into it, which was used intentionally as part of the economic abuse, but also was an impact of it. And all these forms of economic abuse also happened alongside and was linked to threats, verbal and emotional abuse, or violence. And immigration was used to further control and isolate. Regardless of the source of economic abuse or the type, what was interesting was the experience was gendered and ageist. So it was rooted in beliefs about women and financial decision-making or the role of money, or about beliefs around older women's role in finances. So for example, I have a quote down on the screen. One service provider explained that senior women can be seen as not understanding or having the need to access money, for both ages and attitudes around gender and money. Just fix that. We found that all these different types of economic abuse tactics had far-reaching impacts. Sorry about that. I'll have a few of them on screen, but I'll highlight just a few of them. So a lot of the participants and service providers described a loss of freedom. So loss of decision-making over finances was linked to how to spend their time. And this might have been linked to other financial control or exploitation, such as not having enough time for themselves to see their friends because they had to take care of their grandchildren and they didn't have a choice of that. Deterioration of health was also mentioned as a major impact. So that might have been exhaustion from the exploitation, or because they didn't have access to necessities, so lack of nutrition, or also withholding medication or other medical necessities. And often because of the immigration, there was a loss of their quality of life. So they might have had jobs in their country of origin and were economically secure. But once they moved here, that was all stripped by the abusive family members or the abusive partner. And there were a number of emotional impacts of this, depression, feeling helplessness, and a lot of them mentioned this sense of resignation that because of their age and where they're at in life, they can't change this. So how can we support senior immigrant women experiencing economic abuse? Firstly, survivors and service providers highlighted the high barriers senior immigrant women face when they seek support. And these barriers were cumulative and worked to kind of block their access to services. So a main one was language barriers. They couldn't find services that spoke their language. And another one was having culturally competent services. So what they felt comfortable with and where they would feel understood and also not judged or have their culture stereotyped. Also, because of the immigration and usually for newcomer women, lack of knowledge of services and rights. So this might have been as a process of one, being completely dependent on their sponsor, who are often the abuser, for information. Other one, just the side effect of being in a new country and having to learn about services. And thirdly, they might have not have a reference point for some of the services. So they might have not had the concept of income support or different types of banking services because those weren't present in their country of origin. So they wouldn't know to look for these in the first place. They also faced fears for repercussions for seeking help. So fears for negative consequences to themselves, their immigration status, but also to the family members, even if they were abusers, because often they were their adult children. They also faced fears around confidentiality and how confusing about confidentiality, and sometimes a mistrust of authorities as well. Lack of Canadian experience and or recognition of non-Canadian qualifications became a barrier for them to try and seek financial independence through looking through jobs because they couldn't become, they faced a lot of discrimination based on the lack of Canadian experience. And also just a general lack of finances stopped them from seeking services. That might have been because they didn't have enough money to get transportation to services, but also other things, for example, like they didn't have appropriate clothing for the winter, so they couldn't go out and find help. What were some of the recommendations that came from the study? Firstly, to invest in culturally and language appropriate services. That was one of the main ones that they wanted, or service providers and senior immigrant women wanted. Secondly, addressing women's access to services in isolation. So targeted outreach, maybe in centers of worship or other community groups. Addressing women's intersecting needs through wraparound services. So senior immigrant women might need settlement services, newcomer services, practically how to open a bank account, how to do banking here, how to read paperwork if they don't know the language, as well as bigger pieces of services for housing security and rights around their finances. They also need help to increase their knowledge of their financial and immigration rights. So that includes access to lawyers or support to go and see a lawyer, and general education on services and resources, because of those things that they might not have the concept of those services if they were different in their country of origin. We also heard from service providers that they wanted capacity building around economic abuse of senior immigrant women. So they wanted to know how to recognize this, especially exploitation, and also how to recognize the different definitions of economic abuse as well. And lastly, I just wanted to highlight some resources that we have from this project. So these are available for free for service providers and survivors. They're available through the Women Act website. We've created information leaflets for senior immigrant women in 11 languages, and there's also audio versions of these available on YouTube in the same languages. Thank you very much, and I'm always open for questions, so please do feel free to email me.
I appreciate that so much there, Pramila. And in the interest of time, we're gonna move ahead to our last presenter, Miranda Filipchuk. But we'll have time to circle back and with any questions at the end of the session. So Miranda, if I could please open it up to you to talk about the research that's underway with the Alberta Council of Women's Shelters. Thank you so much.
Thank you very much. I sure can. All right, I think I'm sharing my screen now. Can you see it all right? Yes, perfect. Thank you so much. So thank you for having me, and thank you to my incredible co-panelists for all of the really wonderful, important research you're doing. It's just really incredible to hear what everyone is up to. So I'm here with you today to talk to you about one of our ongoing research projects that we're in the midst of running at ACWS, which is what I'm kind of loosely referring to right now as the Economic Abuse and Rebuilding Research Project. And I do want to take a moment to thank our generous funders, Service Credit Union, for providing us with support for this work as we do it. So before we delve into the content of this presentation, I want to begin with ACWS's traditional land acknowledgement to honor the Indigenous peoples on whose land this research is taking place. ACWS acknowledges the traditional lands upon which we live, work, and play. We recognize that all Albertans are treaty people and have a responsibility to understand our history so that we can learn from the past, be aware of the present, and create a just and caring future. ACWS celebrates and values the resiliency, successes, and teachings that Indigenous people have shown us, as well as the unique contributions of every Albertan. The ACWS office is located on Treaty 6 land in Amiskwaciwâskahikan, which is the traditional territory of the Plains Cree and an ancient gathering place of many Indigenous peoples for thousands of years. These lands have also been home to and a central trading place of the Blackfoot, Nakota, Assiniboine, Dene, and the Métis people of Western Canada. We honor the courage and strength of Indigenous women. We honor them as life givers and caregivers as we honor and learn from their continuing achievements, their consistent strength, and their remarkable endurance. Our members serve all nations and all peoples. They are located on Treaty 4, 6, 7, and 8 lands across the province, which include the 6 Métis regions of Alberta. The project I'm discussing today on economic abuse and rebuilding in Alberta aims to accomplish 2 things. First, we want to better understand the state of economic abuse in Alberta, especially in the context of the COVID-19 pandemic. We know that economic abuse is one of the most common forms of abuse that survivors face. And we've been hearing anecdotally from our members that the pandemic has impacted the way survivors experience abuse. So given these reports, there is a clear need to better understand the current state of economic abuse. And the second thing we're hoping to accomplish here is that we want to propose some concrete solutions to support survivors as they rebuild after experiencing economic abuse. And in particular, we've been exploring the possibility of a matched savings program developed specifically for survivors who are in longer term shelters or what we call second stage shelters. And we're also looking at other possibilities as well. The project was designed to have 5 major components: a literature review of academic and community-based research on the subject of economic abuse, consultations with our members and community partners who have experience running economic support programs for survivors, surveys for service providers who support economic abuse survivors, We have distributed 2 of these surveys, one to our members and one to community partners who may also support economic abuse survivors. Focus groups with service providers who support economic abuse survivors. And again, we're doing these both with our own members and with some of our community partners. And finally, we're also hoping to run focus groups with survivors who have participated in economic support programs that are currently being offered by our members. Today, I'm going to share with you some preliminary results from the survey we conducted with our members, most of which focus on the current state of economic abuse in Alberta. And the results I'm going to share with you highlight a few different themes, which include the types of economic abuse that are really common in Alberta, intersectional factors that impact the experience of economic abuse, myths about economic abuse, the impact of the COVID-19 pandemic, the state of economic supports available to survivors, and systemic barriers survivors access or survivors experience when accessing those supports. So these are the most common types of economic abuse that our members report encountering. Now, the full list is much longer than this, but these are the kinds of abuse that 85% or more of our survey respondents report observing in their clients' cases. So this list includes accumulation of debt, as particularly as a result of the abusive relationship, theft of money or property, negatively impacted credit score, loss of income, restricted access to bank accounts, loss of savings, reduced or lost employment, and denial of child support. One of our most important findings is that survivors who have intersectional identities or who belong to multiple communities or groups that have experienced marginalization or oppression experience disparate impacts of economic abuse. Again, the full list of intersectional identity factors that impact a survivor's experience is much longer than this. But 70% or more of our survey respondents indicated that these identity factors have impacted the abuse their clients experience. This includes Indigenous identity, socioeconomic status, age, immigration status, disability, survivors who have children, and race or ethnicity. And I do want to note that these numbers are only based on the experiences of service providers and not on the experiences of survivors themselves. And because of that, they may underestimate the full extent of the disparate impact of economic abuse on survivors with intersectional identities. Our members also report that there are a number of harmful myths about economic abuse that may negatively impact both public understanding and awareness of economic abuse and the public response to it. And what you see in this word collage represents some of the common themes our members raised. They include sentiments that economic abuse only happens to people with low income. It only happens to irresponsible people. It wouldn't happen to someone like me. It's not real abuse. It's not as serious as other forms of abuse. Rebuilding is easy. And if someone is experiencing economic abuse, it's their own fault. So to no one's surprise, our members report that the COVID-19 pandemic has made the experience of economic abuse substantially worse. Some of the key data points from our survey include 85% of respondents report that economic abuse has increased during the pandemic. 81% report that survivors have reduced access to affordable housing as a result of the pandemic. 80% report that survivors have reduced access to essential services. 75% report that survivors have experienced a reduction or elimination of employment because of the pandemic. And 73% report that survivors have reduced access to childcare. And these are, of course, all essential needs that impact both the severity of the experience of economic abuse and the rebuilding process for survivors. There are a number of economic supports in place that survivors in Alberta can access. And unfortunately, there is a near unanimous agreement that these supports are inadequate. So 92% of our survey respondents report that the economic supports survivors have access to are insufficient to meet their needs. And a further 95% of respondents report that survivors experience substantial barriers to accessing these supports. These barriers are very extensive. And so I did that thing you're never supposed to do where I crammed way too many words onto one slide, but just to give you a sense of some of them, not all of them, these are the most commonly mentioned barriers that came up. And they include lack of documentation, right? So specifically ID, including birth certificates, the driver's license, or other important documentation, lack of permanent address, lack of employment history, lack of transportation, which is especially prevalent in remote or rural communities. Lack of access to government offices, which is again another issue that disproportionately impacts our rural and remote communities. Lack of computer skills, lack of access to technology, including computers or mobile phones they might need in order to submit applications for support. Language barriers, someone having too much money or assets to receive support. The rising cost of living, biased landlords who refuse to rent to survivors who may be on income support or other forms of social assistance. Banks are not compassionate institutions, and that's something that came up quite a bit. Government supports are inadequate. Government supports are also not trauma informed, and the process of going through the process of actually obtaining supports through the government can be quite re-traumatizing. And of course, systemic discrimination. And again, for survivors who are part of communities that have experienced marginalization or oppression, including Indigenous, Black, people of color, newcomer, and 2S LGBTQ+ survivors, these barriers are all amplified. That's the end of my formal time with you. And I don't want to leave you with that really heavy kind of information. I want to leave you with a spirit of hope and not of despair. So I do want to note that for all of the many barriers that economic abuse survivors face, we know that they are inventive and resilient, and that they develop incredible strategies for navigating the impossible situations they are faced with. And we also know that service providers have developed effective informal strategies for supporting survivors in navigating the complex systems that are supposed to be helping them. So we are currently working on gathering the insights of service providers and survivors to make recommendations for formalized supports that will build on the knowledge and skills survivors and service providers already have to better support survivors on their rebuilding journey. And we look forward to sharing the results of that research once it is complete. As I noted, this is kind of an ongoing research project, so we don't have a completed report to share with you all today. But if you would like to learn more about ACWS or our research program, you can visit our website there, www.acws.ca. And that is all for me. Thank you very much.
Miranda, thank you so much. And to all of our speakers, a big heartfelt thank you for sharing this very interesting research. What I've just learned is that unfortunately, there was quite a bit here to unpack, and so there won't be an opportunity for Q&A at the end of today's session. And I think what I'll do is commit CCFWE to getting back to those who did present questions in the dialogue to forward those to our panelists and get back to attendees with answers to those. And is there anything else from CCFWE coordinators?
No, this is wonderful. Thank you, Mary Rose, for moderating, and for the panelists for showing and showcasing their work, showcasing the research. I think we're just at the very beginning of this research, and we just need to continue. So thank you, everyone. I will be stopping the recording because this is the end of this session. And yes, if you do have questions, keep putting them into the Q&A function. We will be capturing those questions. And then probably give us 2-3 minutes to transition, if that's okay. We're trying to stay on track, on time. I think we're about 4 minutes over. I don't think that's too bad. So I will stop the recording right now.